At a certain point in life, the pursuit of health can sometimes cross into the territory of unnecessary risk. After 70, you've likely had your fair share of tests, scans, and appointments. And while many screenings are important, others might actually do more harm than good. It's not something most people hear about, especially in a world where medical testing is seen as a gold standard for prevention. But the truth is, as you age, your body changes, your risks shift, and not every test that once made sense continues to offer benefits. Some might expose you to radiation, cause needless anxiety, or even lead to invasive procedures that you never needed in the first place. Take, for example, the story of Harold. He was 76, in generally good health, and went in for a full-body CT scan as part of a routine wellness check. The scan picked up a small spot on his lung. His doctor, being cautious, ordered a biopsy. That biopsy led to a collapsed lung and a 5-day hospital stay. What was the spot? Scar tissue from childhood illness. Totally harmless. But the cascade of testing triggered a problem that his body, at that age, struggled to recover from. That's the reality many seniors face. Tests meant to help can sometimes hurt. Let's talk about why that happens. As you get older, the probability of incidental findings, those tiny, often meaningless abnormalities, goes up. Your body has been through a lot. Wear and tear shows up in scans, and many of these abnormalities are benign. But once found, doctors often feel compelled to investigate them. It's called the cascade effect. One test leads to another, then another, and sometimes a perfectly healthy person ends up undergoing invasive treatment for something that never needed fixing. This is especially true with certain types of screenings. One example is the colonoscopy. For years, it's been a cornerstone of cancer prevention. But after age 75, the benefits start to decline while the risks increase. Bowel perforation, bleeding, complications from anesthesia. These risks become more common as you age. And if you've had regular screenings with no signs of trouble, your risk of developing colon cancer late in life is low. That's why many health experts now recommend against routine colonoscopies after 75, unless there's a very good reason. Another example is the PSA test for prostate cancer. For men over 70, it's often more harmful than helpful. The PSA test is very sensitive. It picks up even minor prostate changes. But most of the prostate cancers found in older men are so slow-growing, they never cause symptoms in a person's lifetime. However, once diagnosed, many men feel pressure to act. That can mean surgery or radiation, both of which carry major risks, like incontinence, erectile dysfunction, and infections. And for what? A cancer that might have stayed quiet for the rest of your life. That's why organizations like the U.S. Preventive Services Task Force advise against routine PSA screening after age 70. The risks simply outweigh the rewards. Then there's the full-body CT scan, a favorite of executive physicals and high-end wellness packages. It sounds smart, even luxurious. But what people don't realize is that these scans expose you to high levels of radiation. One scan could be equal to hundreds of chest x-rays. And they often find things, tiny nodules, calcium buildups, cysts, that are meaningless. But once they're found, more tests follow. Biopsies, PET scans, surgeries, all chasing down shadows that didn't need attention. The truth is, full-body scans aren't recommended by any major medical organization for routine use. They're too broad, too vague, and too risky for people in their 70s. Let's also talk about mammograms. Breast cancer screening has saved lives. But after 74, the balance between benefit and harm becomes less clear. That's not to say women over 70 shouldn't get mammograms, but it should be an individual decision based on personal risk, health status, and life expectancy. For some, a mammogram might still be a good choice. For others, especially those with other chronic conditions or limited mobility, it may be a test that adds more stress than benefit. False positives are more common with age. That means being called back for more scans, ultrasounds, or even biopsies, each one carrying its own risks, both physical and emotional. One of the more surprising examples is the bone density test. Osteoporosis is a real concern for older adults, especially women. But routine repeat testing after a certain age, especially when someone is already on treatment, may not change the outcome. The medications used for osteoporosis don't always require frequent monitoring. Yet many seniors undergo annual DEXA scans, only to have the same result and no change in treatment. It's extra radiation, extra cost, and often no added value. The focus should be on fall prevention, strength building, and medication adherence, not on chasing numbers every year. So why do so many people continue with these tests? Often it's habit, or fear, or the belief that more testing equals better care. But the truth is, good medicine is about balance, about knowing when to intervene and when to leave well enough alone. Especially after 70, when the body's ability to bounce back from stress and trauma isn't what it once was. That doesn't mean you shouldn't stay informed. Quite the opposite. In fact, the most powerful thing you can do as you age is to ask better questions. Ask your doctor, what will this test tell us? How will it change what we do? What are the risks of doing it and the risks of skipping it? Those questions can open the door to smarter, more personalized care. And here's the part that matters most. Health isn't just about catching every possible disease. It's about preserving your quality of life, protecting your independence, avoiding harm. And sometimes that means saying no to a test, not out of denial, but out of wisdom. Take a moment to reflect on your own medical journey. Are there tests or procedures you've been doing automatically year after year without really knowing why? Are you making choices based on fear or on facts? Are you focused on living longer or living better? Your time, your energy, your peace of mind, they're worth protecting. And sometimes the best form of protection is simply asking, do I really need this? In the end, healthcare isn't one size fits all. What works for a 50-year-old may not work for someone at 75 or 80. The risks shift, the priorities change, and that's okay. Aging isn't a failure. It's a new phase of life, with its own strengths, challenges, and wisdom. So if you're over 70 and feeling overwhelmed by all the tests being thrown your way, take a breath. Talk to your doctor. Make decisions together. And remember, real health isn't about doing everything. It's about doing what matters most, safely, wisely, and with your values at the center. Because in the end, your health isn't defined by test results. It's defined by how you feel, how you live, and how much joy and function you can hold on to as the years go by. You've earned the right to choose wisely. So don't be afraid to say yes to what helps and no to what doesn't. If this video gave you a new perspective, give it a like. Share it with someone who needs to hear this message. And in the comments, tell us, what health decisions are you rethinking after 70? Thanks for watching. Stay safe, stay smart, and remember, your health is about more than tests. It's about you.